So let's talk about something you might not have heard of, but is absolutely crucial in healthcare today: breastfeeding and lactation medicine. It's this fascinating and vital field that honestly is still a bit of a mystery to a lot of people. Today, we're going to pull back that curtain. And just to be clear, this isn't about general advice you could find online. We're talking about a dedicated medical subspecialty designed to help families navigate the very real and often very complex challenges of breastfeeding.
All right, so here's our game plan for this deep dive. We're going to break down what this field actually is, why it's so desperately needed, who the different players on the support team are, how these specialists actually work, and, what's next on the horizon. Think of it as your complete consultation on the topic.
First things first, before we get into the nitty-gritty, we have to tackle the big fundamental question. What are we really talking about when we say BFLM? Let's get a nice, clear definition on the table.
Okay, so here's the most important thing to grasp right away. BFLM, or Breastfeeding and Lactation Medicine, is a formal, evidence-based medical subspecialty. It looks at lactation not just as a choice or a behavior, but as a really complex biological system. It digs into the physiology, how the body works. It addresses pathologies, when things go medically wrong. And it takes into account the incredibly powerful psychological and social factors at play. In short, this is serious medical care.
And you can see their role is incredibly broad. It goes way beyond just direct clinical care for both the parent and the child. These providers are also advocates, out there fighting for better policies. They're researchers pushing to expand our understanding of human milk. And they're leaders in huge global health initiatives. It is a truly multifaceted specialty. They wear a lot of hats.
Now, this brings us to a really key question. If breastfeeding is supposed to be the biological norm, the natural way to feed a baby, then why on earth do we need an entire medical field dedicated to it? Well, the data tells a pretty powerful story. While most babies do start out breastfeeding, the World Health Organization has a goal for 70% to be exclusively breastfed for their first 6 months. As you can see, we are nowhere close to that. The global rate is just 48%. That means more than half of infants around the world are not meeting this key public health recommendation. So what is causing this massive gap between what families want to do and what they're actually able to do? What's going on here? Well, the challenges are multi-layered. It's not just one thing. At the very highest level, you have these big structural barriers, like a lack of political will and, frankly, the massive, aggressive influence of the formula industry. Then you zoom into the settings where families live and work. You see inconsistent support in hospitals and a serious lack of adequate paid leave. And all of that pressure trickles down to the individual, who's left trying to navigate misinformation and a real lack of skilled support. And wow, this quote from The Lancet just captures the scale of that problem perfectly. It points out that formula marketing isn't just a few ads on TV, it's a system engineered to influence everyone, from individual parents all the way up to public policymakers. Now, families who are facing these challenges, they're not totally alone. There's a whole ecosystem of support out there, and it's actually fascinating to see how it's evolved over the years. The support system for breastfeeding has grown so much over the last 70 years. It started with grassroots, peer-to-peer mothering groups like Lalage League. Then came the professionalization of the field, with certifications for lactation consultants or IBCLCs, and eventually we saw the founding of the Academy of Breastfeeding Medicine, which really marked the formal entry of physicians into this specialized area of care.
So that's the big question, right? With all these different kinds of support available, what is the specific, unique role that a breastfeeding and lactation medicine provider plays? What makes them different? This slide right here really gets to the heart of it. While peer counselors and IBCLCs provide absolutely vital, essential education and support, the key distinction is this. Only a BFLM provider, because they are a licensed physician, can make medical diagnoses and prescribe treatments. They have the ability to address underlying health conditions in both the parent and the child, connecting all the medical dots in a way no one else can.
Okay, so what does this actually look like in practice? How does that unique medical training translate into the day-to-day care of patients?
The core concept here is the dyad. It's everything. A BFLM specialist doesn't just treat an infant or just treat a parent as separate individuals. They treat the breastfeeding pair as a single, interdependent biological unit, because the health of one directly and immediately impacts the health of the other. Their entire care model reflects that simple but profound reality. And here is a perfect real-world example of one of these dyadic problems. It often starts with something that seems kind of small, right? Like an infant having a poor latch. But that's not just the baby's problem. It immediately leads to low milk transfer, which then signals the parent's body to downregulate to produce less milk. And suddenly, boom, you're in a vicious cycle of poor growth for the baby and pain and distress for the parent. A BFLM provider is trained to see this entire cascade and know exactly where to step in and break this cycle. Let's really bring this home with a case study. An infant has poor weight gain. In a low support environment, the advice is often just switch to formula. End of story. In a high support setting, but one without a BFLM specialist, that poor family gets bounced around between a pediatrician, a lactation consultant, maybe a surgeon. The care is fragmented and delayed. But with a BFLM provider, one single doctor assesses the whole picture, performs a necessary procedure if needed, manages the milk supply, and supports the parent's well-being all in one place. The difference in the outcome is it's enormous.
So, given how incredibly valuable this specialty is, what does the future hold? Where is all of this heading? What's standing in the way of every family having access to this kind of integrated, specialized care? What are the roadblocks?
And the hurdles are pretty significant. First off, there's a huge gap in standard medical school training, which means many doctors don't even know this specialty exists or when to refer patients. Then there's the constant struggle with insurance reimbursement. The research agenda often doesn't focus on the common, everyday clinical problems families are actually facing. And, of course, towering over all of it is the constant competition with the messaging of the multi-billion-dollar commercial formula industry. And this really is the ultimate goal. For this field to truly thrive and be sustainable, it can't just rely on a few passionate individuals being local champions. It needs to be woven into the very fabric of our health systems. It needs formal divisions, medical directorships. It needs to be recognized as the essential subspecialty that it truly is. And that leaves us with one final, pretty powerful question to think about. This entire field exists to provide medical care for a normal biological process. A process that has been systematically undermined for generations. So the real question we have to ask ourselves is, why is something so fundamental still having to fight for its rightful place in modern medicine?